Good day, and welcome to the second day of the first Innovation Forum of WHO Western Pacific region. This is the session, Innovation in Design, Better Environment for Health. My name is Marco Martuzzi. I am the head of the WHO Asia Pacific Center for Environment and Health, based in Seoul, Republic of Korea. And thank you very much, everybody, for joining this session today. The session will address climate change, environment, and health, and this is one of the 4 priority areas for the future, the vision for public health in the region for the coming years. Climate change, environment, and health has seen an extremely rapid evolution lately. On the one hand, challenges have been escalating. Think of accelerating climate breakdown or the environmental impact of globalization, COVID-19 being perhaps an example of that, and the ubiquitous presence of air pollution. At the same time, the theory and practice of the discipline of environment and health and climate change has been responding to these challenges and has produced not only innovative methods and tools, but also new ways of thinking, ways of embracing the complexity of the systems underlying human health and sustainability. Such innovation has resulted in phenomenal advances in our understanding of the nexus between environment and human health, achieved thanks to methods and tools we're going to hear about in this session. This understanding is also has been helping clarify what best can be done to protect and promote human health. We came a long way in our understanding and realization of inequalities of vulnerable populations, such as the elderly, the children, and future generations. The current challenge is now to capitalize on such innovation, stimulate more of it, more rethink, redesign research, as we heard yesterday, and make it more relevant on the ground, and crucially, more accessible to everybody. We are delighted today to have a great panel. If we are to tackle the challenges ahead, we need to hear from a variety of disciplines and standpoints. Think of climate change. Some people describe our current predicament as one where stakes are high, facts are contested, values in dispute, and decisions urgent. So against that background, we need to involve scientists, experts, decision makers, citizens, interest groups, and various stakeholders. We need to talk about evidence, uncertainty, complexity, fairness, values. We need strong science and strong advocacy alike, and good communication. So we are truly grateful today to our distinguished guests and look forward to hearing their insights on innovation in climate change, environment, and health. We will be talking about environment in the broad sense, encompassing, for example, the social and the urban environment as well. We will see what strong advocacy and communication can be like. We will have now 5 interventions to be followed by question and answers. I invite you all to submit your questions through the Q&A facility here in Zoom. I'd like to draw your attention also to our disclaimers. That we invite all participants to exchange ideas and refrain from sharing marketing messages or inappropriate statements. And we reserve the right to remove participants that do not adhere to these guidelines. So thank you very much for that. And we move to the interventions now, starting with a recorded intervention by Professor Paolo Vines of Imperial College, UK, who has recorded this intervention for us, which will come up in a second. Thank you.
Hello, good morning. I'm Paolo Vines. I'm Professor of Environmental Epidemiology at Imperial College in London. And this is my contribution to the Innovation Forum of WHO Pacific region. And I've been invited to talk about innovation, in particular in epidemiology, and applied to our current needs, which concern the relationships between human health and planetary health. So I will share my screen now, and I have a few slides to show. Okay, so my theme today is innovation in epidemiology, and specifically connecting molecules and populations. I want to share with you a few experiences concerning the concept of the exposome in particular. So the general planetary challenges have been described by other people. I refer in particular to the Stockholm group by Rockstrom and Stephens. What I want to explore and expand on is also the so-called philosophy of co-benefits. This is a proposal which is inherent in the various COPs, for example, COP25 last year in Madrid. The idea is that by tackling climate change, for example, or other planetary challenges, you can also have benefits in the field of health. So you may put in practice actions or policies that mitigate climate change and also have a benefit, an advantage for public health. And I will make a few examples. So this is the theoretical framework proposed by Rockstrom and Stephen of the 9 planetary boundaries that shouldn't be overcome. Otherwise, the situation might be unbearable and irreversible. Among those, we have climate change, but also genetic diversity, which means the loss of biodiversity and a few others. I will mainly refer to climate change. As I said, the current philosophy adopted, for example, by the conferences of the parties like COP25 and the next COP26 is this idea of co-benefits is key, and it means that, for example, changing our dietary habits, reducing meat consumption in favor of legumes, for example, we may have a short-term individual and population health benefits, like a reduction in cardiovascular diseases, cancer, or certain types of cancer, and possibly a reduction in healthcare costs, but also long-term environmental and societal benefits, reduction in global warming, for example. The same can be said for coal. In this case, we would have health benefits in terms of reduction of black lung disease, and again, a benefit and advantage for climate and in general for air pollution. I mentioned meat intake. In fact, there are several policies that can be undertaken from the point of view of food and agriculture. For example, in this specific case, which is the EPIC cohort in Europe, we have shown that meat intake is associated with an increased risk of cardiovascular diseases and certain types of cancer, but also with increased emissions of greenhouse gases on the left, and greater contribution to land use in the world. And you see that at the opposite extreme of the scale, you find legumes, whose contribution to both greenhouse gases and land use is very small. So an example of co-benefits. A reduction in the intake of meat would also imply lower exposure to viruses, because many, well, I would say a large proportion of zoonosis, that is diseases in humans that are due to viruses or parasites transmitted by animals, is attributable to animal breeding, cows, pigs, chicken, and so on. So a large number of zoonoses could be prevented by reducing extensive animal breeding. Now, the issue is that epidemiology and public health need to refine their methods and tools because we have very serious challenges ahead of us, but epidemiology is still relatively underdeveloped. And I want to show a few examples of what we call the exposome approach. The exposome means a set of tools to study the effect of environmental exposures from conception onwards during the life course. So there is a very important life course component and also a laboratory component and an innovation component associated with the exposome approach. It allows an agnostic that is free of hypothesis-free analysis of the environment, an assessment of joint effects like in mixtures, improvement of exposure assessment, improvement of mechanistic understanding, and may reveal common roots of different diseases through pathway perturbation. Just a few examples. This is the blood exposome, a paper we published a few years ago, showing that a large number of chemicals can be measured in blood, in human blood. Many of them are physiological, like homocysteine, cortisol. Others are related to diet, like folic acid, vitamins. Others are drugs like simvastatin, aspirin. So these chemicals, like physiological chemicals, molecules, or drugs or nutrients, are at a relatively high concentration in blood, whereas exogenous chemicals, contaminants like arsenic, DDE, benzene, PCBs are at low levels, and they are at the limit of detection, which means that we need to improve our methods if we want to really study the effects of the environment. In terms of pathways, it is quite interesting to be able to study pathway perturbation via molecules. A few examples like bisphenol A or phthalates, which are very common environmental contaminants, they act on different receptors or intermediate molecules in the body. And this in turn leads to different health outcomes, like an increase in body weight, adipogenesis. So exposome research also means the investigation of pathways, which is very useful both for a mechanistic understanding of disease and for hazard identification and risk assessment. And this concept is contained in a document by the National Academy of Sciences in the United States, which is called Using 21st Century Science. Another application of the exposome is related to epigenetics that can allow us to study long-term exposure. What we found was that people who had been smokers and quit had certain epigenetic changes, that is methylation of DNA, that were stable for 25 to 30 years in specific genes. So it seems that methylation of certain genes is reversible in the short term after quitting exposure, but it is stable for a very long time, 25 or 30 years after quitting exposure. Another important message from the point of view of public health. In general, we try to use a life course approach. This is another piece of investigation we did. It refers to two different social groups, high socioeconomic status in blue and low socioeconomic status in red. And what we see is that there are already social differences at start in the level of exposure, like low vegetable and fruit consumption in low socioeconomic groups, low physical activity in the same, more frequent smoking and earlier onset of smoking or uptake of smoking, which in turn leads to increase the body mass index at the age of 20-25, increase the blood pressure a little later, increase the triglycerides, and at the end we showed that at the age of 55, people in low socioeconomic status had a greater risk of diabetes and cardiovascular disease. So this shows the usefulness of a life course approach. Final slide, the exposome allows us to improve our investigations, epidemiological investigations with the use of biomarkers, which are sometimes more sensitive and they change earlier than disease itself. So we don't have to wait for decades to show an effect in terms of disease. This is what we call epigenetic age acceleration based on DNA methylation. And we show that people with low socioeconomic status had increased epigenetic age acceleration compared to people in the high socioeconomic status group, using 4 different types of markers. The results are quite consistent, and the effect on socioeconomic status is independent of risk factors like smoking, BMI, alcohol, physical activity, and others. Thank you. So my main point is that we should become able to apply this kind of technological innovation to the challenges we're facing today. Many more challenges than those I referred to. In fact, I initially referred to Stefan, the issue of planetary boundaries, and this is only one. We can also think of the nitrogen cycle. We can think of the effects of biodiversity. For each of those, we have to improve our techniques, our technologies, and in particular, I refer to epidemiological technologies that allow to investigate the impact on health. Thank you.
Okay, Professor Vinis is not with us. We'll convey our thanks again because we're really grateful for this impressive presentation that gave us really a taste, although a quick one, a taste of the extremely promising advances in the science on the relationship between environmental factors and human health. The questions you might have for Professor Vinis will not be, we won't be able to have him on board in the discussion. However, please share them with us. And from now on, the questions you might have for the next panelist, we will try to address in the Q&A section. Next up is Professor Sandro Galea, the Dean of the School of Public Health of the Boston University in the US. If you attended the opening session yesterday, you have already heard about his groundbreaking work on the urban environment. So today we're going to hear more of that, with particular in relation to aging population in. So Sandro, the floor is yours. Thank you.
Thank you, Marco, and thank you everybody for having me. And it's a delight to join you here again today. Let me share my screen. Marco, you can see that okay? I will take it you can. As Marco said, I spoke a little bit about the new urban health yesterday, and today in these brief remarks, I just want to talk about innovation for healthy aging. And really, it's an extension of my of what I talked about in my keynote yesterday. But really what I want to do today is just help focus everybody in the conversation on how one applies some of the general principles that I talked about yesterday. So I want to start this way, and I want to start with this picture, and you might all be looking at that picture and wondering what it is. And it is a picture of a kangaroo. And now you're wondering, the kangaroo does not look like that, because everybody in this audience knows what a kangaroo looks like. But this was a painting by the Dutch artist Cornelis de Hood, who never saw a kangaroo. He painted a kangaroo based on the narratives of Dutch sailors who initially went to Australia and saw kangaroos. And you can imagine why, if you've never seen a kangaroo and you're hearing narratives, you would paint it looking like this. It's got a long neck, and it's got a pouch where it carries its newborn babies. And it's got strong, powerful arms. So you can imagine why you might think a kangaroo looks like this. The reason I'm starting with this is to make the point that not infrequently we see the world through a particular lens, and that lens is not accurate. And we need to correct our lens by rethinking. And I think that's the situation we are in with aging and aging in cities. It is a different lens that we need, and it is a different set of thinking that we need to think about innovating in cities for healthy aging. Because our conception of health in aging is this. We tend to think of aging as old people who are sick. And I think we need to change our conception, and our conception really needs to change from exceptions, few old people who are sick in cities, to thinking about people who are aging, who are much more common in cities than they used to be. And in fact, they are becoming more and more the norm in cities, which changes how we think, to thinking about creating a city that accommodates people who are older, to having a city where being older is the norm. And I think that's the innovation that we need to bring about. And just to make this case, I just want to show you very quickly population pyramids. These are age pyramids. You've all seen them in general idea. This is 1970. This is 1990. This is 2010. This is 2030. And that's 2050. The notion that being older, being over 45, 55, 65 is unusual is gone. We already are in a place in the world where there are more people over 65 than there are under the age of 5. And by 2050, there are going to be as many people who are between 65 and 69 as there are between 30 and 34. So we need to change our conception of that kangaroo. Aging is no longer unusual. Being older in cities is no longer unusual. Being older in cities is in fact normative. This is a simple map of the proportion of population age 60 or older by country in 2015, just 5 years ago. Only Japan had 30% of population that was more than 60 years or older in 2015. 2050, it is going to be a lot of countries in the Western Pacific region, essentially all of Europe, essentially much of the Americas as well. That is a tremendous shift. So we are moving very rapidly in the next 20, 30 years where aging is normative in cities, and where we should be thinking about aging as a way that we normally are in cities, and designing cities to be friendly to that population. And I will point out that we already are seeing some of this. In the US, for example, we've had, looks at COVID cases, which have been predominantly in large urban areas, in no small part because this is where older people are in cities today. So the key innovation that I think we need to bring about is we need to think about urban healthy aging as a norm, not as an exception. So how do we do that? Now, I could talk quite a bit about this, and I could talk sort of for hours rather than the 10 minutes which I have here. But I want to focus us just on 4 aspects. And I want to show you a data slide for each of the 4 aspects, and then simply say that I think we need to innovate in a particular direction. I'll start with this. I'll start with opportunities for exercise. This slide looks at the percent of trips made in urban areas by walking and bicycling in the US, where I live, and in Germany. And all I want to show you here is the extraordinary difference in the proportion of trips made by biking in Germany versus the United States, and how in Germany it goes up with age, while in my country essentially stays the same, if not sort of goes a little bit down with age. Oops, I apologize. This suggests to me that we need to reimagine our physical environment. I can assure you, there's no real difference between Americans over 65 and Germans over 65. The same person, same species. The difference is the environment in which we live. And we need to reimagine our physical environment, as several countries in the Western Pacific region have done. This is actually Singapore, looking at the gardens that have been created in Singapore, no small part to encourage activity by people who are older. And this is very much a design choice, an intentional choice to create an environment where exercise at all ages becomes the norm. This is a separate dimension. That's the physical environment. Now I want to talk about the social environment. And all I want to show you is the incredible importance of the social environment. What this slide is a big slide, but what I want you to look at is, these are meta-analyses. These are effect estimates. And look at these. Look at the effect estimates for social relationships. These are effect estimates for social relationships. These are effect estimates for smoking. This is for drinking. This is for flu vaccine. This is for cardiac rehabilitation. Social relationships, in terms of their effect on mortality, dwarf other things that we in public health think about all the time. Things like smoking, things like drinking, things like vaccination, things like rehabilitation. Social relationships are core to our health. And I actually think that as aging becomes norm, maintaining social relationships and creating the conditions for social relationships, people who start losing loved ones and start losing friends, becomes critical. And I think this means that we need to reimagine our social environment in cities to make for healthy aging. One could talk about that in many different ways. It's just a picture of a communal Tai Chi in China to talk about how we can rethink context to create a social environment that encourages social integration. Reimagining our physical environment, reimagining our social environment. Third is inequality. This looks at life expectancy gaps within US cities. And all I want to show you is that Q1, you look at Q1, which is the richest quartile, Q4 being the poorest quartile. And you see that in US cities, we are seeing a separation of life expectancy gap within cities among the richest and the poorest. And this is true for many cities worldwide. And this inequality is going to result to us consigning many groups and cities of older people to worse health unless we tend to this inequality. So the third form of innovation we need, I think, is to reimagine our shared environment to narrow inequalities, to bring together groups where there are divisions. This is a tall order. This is a huge problem, I think, in cities as we see this greater growth of separation inequality. This is a picture which I really quite like, although it's quite devastating. It's from Mumbai, where on the right you have the Mumbai Stock Exchange, on the left you have an informal urban dwelling or a slum, just to show the dramatic divide between wealthy and less wealthy parts of cities. So third is reimagining our shared environment to narrow gaps. And fourth is our healthcare environment. This is general spending, how much we spend on treatment versus how much we spend on prevention. We spend enormously more on treatment than we do on prevention, even though if I were to do a poll of everyone in this room and say, would you rather get treated for a disease or would you rather not get disease at all? You would all say you'd rather not get the disease at all. But that's not where we spend our money. Our healthcare systems are set up so that we spend far more on treatment than they are on prevention, which I think suggests that we need to reimagine our healthcare environments. And that goes all the way from financing to delivery of care. It requires a rethink, different systems, and a different way of doing healthcare. It requires a way of thinking about healthcare in a way that is different and transcends how we've done it right now in cities. This is a picture of cities in South Africa. So fundamentally, a reimagination of our urban environment, innovating an urban environment for healthy aging requires a rethink of how we design our urban environment. It requires moving away from thinking about older people as being an exceptional small group to thinking about us all aging in cities and creating the physical environment, the social environment, the healthcare environment, and the shared environment that narrows gaps, that is conducive to us all aging through the life course as well as possible towards creating healthier cities for people of all ages. Thank you very much. Thank you for having me. I'll stop there.
Thank you very much, Professor Galea. It's really inspiring to hear from you about the leverage of the urban environment on human health and the way we can redesign it. And you push the envelope even further to include not only the social, but the the healthcare environment. I think it's a very forward-looking approach to the environmental discourse. So thanks very much again. We continue with the theme of the aging population and also building up on yesterday's session on aging. And I'd like now to invite Professor Katsunori Kondo, Professor of Social Epidemiology and Health Policy at Chiba University in Japan. Professor Kondo will tell us about a form of innovation we like a lot, one that involves participation. Professor Kondo, the floor is yours.
Thank you. Can you hear me?
Yes, we can.
And can you see my slide?
Yes.
Okay. Good morning.
Should maybe press preview, like a slideshow?
Yeah, but I had a program using slideshow. So then I would like to go this style.
Okay, we can see them anyway.
Okay.
Go ahead, please.
Okay, the theme of panel 2 is innovation in design, a better environment for health. I will talk about design for aging in the neighborhood and better environment for social participation. The contents of my presentation are listed here. The first topic is, are there healthy and unhealthy community environment? Our answer is yes. And social participation is essential for health. This slide shows our research initiative named Japan Gerontological Evaluation Study. The acronym is JAGES or JAGES. It is one of the few population-based gerontological survey in Japan, established in 1999, more than 20 years ago. This research initiative focused on social determinants of health and social environment. We repeated a cross-sectional survey from 2010 to 2019 4 times, and we follow up most of those older people. And this slide shows huge disparity between municipalities participated in our research project. Using the big data, more than 100,000 older people's response, we found healthy and unhealthy communities environment. This slide shows the prevalence of dependency in IADL, instrumental activities daily living, such as going out, using public transportation services, shopping, cooking, and so on. Among 43 municipalities, the lowest is 7.9%, and the highest is 23%. It means that about 3 times disparity was observed after limited to age 65 to 74 years old people. You can see blue bar indicating urban cities tend to be show lower prevalence of dependency. It means our environment looks like to be better environment for good health. You can see in this slide the prevalence of older people who participate in exercise group in their community. A significant disparity between municipality of the prevalence is also observed. The lowest 12% of older people participated in exercise group in the community, and the highest is 40%. This means more than 3 times disparity exists. We analyze correlation between the prevalence of participation in exercise group in the community and dependency in IADL. We found moderate and significant correlations between these variables. This correlation imply a social participation is good for your health, but by the nature of cross-sectional analysis, reverse causation, which is healthier people who could participate in community organization as they are healthy, is also included. Then we conduct longitudinal study to confirm the direction of causality. After limiting to only independent, healthy older people who can participate in community group, we calculate the odds ratios of mortality or functional decline during 4 years follow-up by the number of kinds of group, hobby, sports, senior club, and so on, participated in. We found this significant dose-response relationship, and this means that older people participated in higher number of groups are likely to be have lower risk for mortality or functional decline. This longitudinal cohort study confirmed that social participation and social relationship is essential factor for health of older people. The second topic is community intervention study. From longitudinal study, we found social participation is essential for good health, but we still need to confirm we can promote and increase social participation among older people. So our purpose of the intervention studies are to evaluate the feasibility to promote and increase social participation among older people, to evaluate the effectiveness of program for healthy aging. We ask volunteers to develop and manage enjoyable social programs. Participants enjoyed ping pong and games. Just chatting is very popular, in particular for women. For other examples, the program includes making short poem and physical exercise. These various programs are instructed by volunteers. We analyze the geographic distribution and relationship between activity sites and residence of participants. The first year in 2007, 3 sites are opened in the central part of the town. A red dot refer the sites program provided, and small orange dot represent participants' residence. After 3 years intervention, 7 sites are open by 2009. And we found that higher number of participants comes from each neighborhood. This means that built environment in terms of good access to the site is important to participate in community. The number of participants and events in the program rapidly increased, and we conducted 5 years follow-up study. After 5 years follow-up, we confirmed that participants in the community program show lower incidence of functional decline. Compared to 40% of non-participants decline their function, 6.3% reduction during 5 years are observed in participants group. We enlarged intervention fields to 25 municipalities. Prevalence of social participation increased 3% point more in 13 intervened municipalities than compared to 12 control municipalities. Mortality in 13 intervened municipalities are significantly lower than control municipalities. Now we confront new program under COVID-19. because social participation is generally good for your health, but bad for infection prevention. Then we are preparing new trial under COVID-19. Even older people are interested in meeting in SNS social network services such as Facebook or Zoom. Among 49 groups participated in older people's groups, 7 groups already use these SNS, and 23 groups would like to use these kind of new services. In sum, more than 6% of group interested in using virtual meeting. So in conclusion, I listed what needed to innovation based on our research. Evidences supporting the effectiveness of social participation for healthy aging are needed to persuade many stakeholders. And shift is needed from biomedical model to biopsychosocial and built environment model. Primary care and community building rather than expensive high technology, and strategy improving access by built environment perspective and ICT is needed. Effective methods promoting social participation and evaluation the effectiveness for healthy aging is also needed. Thank you.
Thank you very much, Professor Kondo, for sharing this most encouraging, I would say, experience and work. I think it's great to see that innovation doesn't need to necessarily involve expensive technology, as you said, but through participation, you manage to really build up, to make very substantial progress. I think it's a very powerful message for all of us. Now we move to Professor Heuni Ha, the Director of Department of Occupational and Environmental Medicine at Ua Women's University. She's sitting not far from our WHO office here in Seoul, in Republic of Korea. With Professor Ha, we move from the aging population as the theme to another vulnerable group, which is children. Children are increasingly burdened by a mounting environmental and climate debt, so to speak. The outlook for future generations is not too promising either. So, Professor Ha, I pass you the floor and hope that you can give us some reasons for some optimism. Thank you. Over to you. Professor Ha, we cannot hear you. Maybe you're muted. We see the slides. I think we lost Professor Ha from the connection. We'll try to resume the connection. And now I suggest we move over to the next panelist, hoping that Professor Ha manages to reconnect with us. As we mentioned earlier at the beginning, good research is essential, but it must go hand in hand with effective and strong advocacy and clever communication. And I think a lot of progress has been made on this compartment, including the use of different forms of art. So I'm now delighted to move to our fifth panelist today, Miss Cassie Jacknell from Marshall Islands. She's a poet, a performance artist, and the co-founder of Jojikum. First, we're going to watch a video she realized, and then she will tell us about that. So if we can have the video, please.
Dear Matafele Beno, you are a 7-month-old sunrise of gummy smiles. You are bald as an egg and bald as the Buddha. Your thighs that are thunder, shrieks that are lightning, so excited for bananas, hugs, and our morning walks along the lagoon. Dear Matafele Beno, I want to tell you about that lagoon, that lucid, sleepy lagoon lounging against the sunrise. Men say that one day, that lagoon will devour you. They say it will gnaw at the shoreline, chew at the roots of your breadfruit trees, gulp down rows of your seawalls, and crunch through your island's shattered bones. They say you, your daughter, and your granddaughter too, will wander rootless, with only a passport to call home. Dear Mata Filipinum, don't cry. Mommy promises you, no one will come and devour you. No greedy whale of a company sharking through political seas, no backwater bullying of businesses with broken morals, no blindfolded bureaucracies gonna push this mother ocean over the edge. No one's drowning, baby. No one's moving. No one's losing their homeland. No one's gonna become a climate change refugee. Or should I say, no one else. To the Carteret Islanders of Papua New Guinea and to the Taro Islanders of Fiji, I take this moment to apologize to you. We are drawing the line here. Because baby, we are going to fight. Your mommy, daddy, boo-boo, dimma, your country, and your president too, we will all fight. And even though there are those hidden behind platinum titles who like to pretend that we don't exist, that the Marshall Islands, Tuvalu, Kiribati, Maldives, and Typhoon Haiyan in the Philippines, and floods of Pakistan, Algeria, and Colombia, and hurricanes, tidal waves, and earthquakes didn't exist, still, there are those who see us. Hands reaching out, fists raising up, banners unfurling, megaphones booming, and we are canoes blocking coal ships. We are the radiance of solar villages. We are the rich, clean soil of the farmer's past. We are petitions blooming from teenage fingertips. We are families biking, recycling, reusing, engineers dreaming, designing, building, artists painting, dancing, writing. We are spreading the word. And there are thousands out on the street, marching with signs, hand in hand, chanting for change now. They're marching for you, baby. They're marching for us. Because we deserve to do more than just survive. We deserve to thrive. Dear Mata Filipinum, you are eyes heavy with drowsy weight. So just close those eyes, baby, and sleep in peace. Because we won't let you down. You'll see.
Hello, Cassie. I think you're connected now, and thank you so much. This video has been out for a while. Every time I see it, I have to say I'm very deeply touched, and I have goosebumps. It's really impressive, and I'd like you to tell us about it, how it came about, your thinking and your work behind it, the motivation, and most importantly, I suppose the impact, the outcome, what happened after that, and the lessons that you drew from it in terms of advocacy and communication on climate change and health. Over to you, Cassie.
Yeah, thank you. Thank you so much for having me, Marco, and thanks for a really illuminating panel on the different ways of innovating health and science and community building. So the poem came out during the UN Secretary General's Assembly, UN Secretary General's Climate Summit back in 2014. They had a civil society call out where they wanted nominations for civil society members, and I was nominated by the then US ambassador to the Marshall Islands, who had seen some poem videos that I had put out a year before on, again, climate change, where I was performing spoken word poetry on climate change as a Marshall Islander, which at the time was really not very common. And so this performance that I gave at the UN was kind of the first of its kind, where I was using spoken word poetry to convey this message about climate change and the importance of it and connecting it to like a global fight. They had actually asked me to write a brand new poem for that performance, and it had to be, I was given a bunch of feedback from different panelists and from different people on what I should speak on. And, you know, initially I had experience writing about the Marshall Islands, but this was the first time where I had to write to a movement. And so that was the real struggle, was how do I write to a movement? How do I write to world leaders? And luckily, I was able to the only way I did it was because I had just had my daughter. She was 7 months old at the time. And I thought, I can't write to world leaders or a movement, but I can write to my daughter and I can tell her what I think we're doing right now. You know, what the fight that that there's so many of us fighting all around the world for this issue and for change. And so that's the poem that came out, was this poem that ended up being my most hopeful piece, because it's a poem that's dedicated to my daughter. And so you're not going to yell at a baby, you're going to say something that you want the future to be hopeful for them. So I think that it transformed the space in the UN considerably, in the sense that it really helped connect people. World leaders were coming up to me, diplomats were coming up to me and telling me about their own children. They were telling me about they wanted to hold my daughter. And I think that it really speaks to something that I was taught early on when I was learning how to write poetry. And the biggest lesson I was taught was to make it universal, make it personal. That's what good art does, in a sense, and that's what good poetry does. You have to personalize it so that people can connect to it. If it's too universal, then it doesn't connect anywhere. But that might be a little vague and hard to understand sometimes. But either way, I think that what that performance did was also spotlight a few things. It spotlit the role of mothers, in the climate movement. It spotlighted the role of poetry, the role of Pacific Islanders as frontliners against climate change. The Marshall Islands is only 2 meters above sea level. And so we are one of the first to disappear, supposedly, because of the rising sea level. But in terms of poetry having that role and arts having that role, I've continued to use kind of the platform that I received, which isn't a huge platform, but it's enough. I've used that platform to continue to advocate for the use of arts in advocacy on climate change and also even now on health. So one kind of tangible output for that was our organization ran a climate and health arts camp for students this past summer, for high school students, where they made connections about COVID and climate change in their poetry, in their songs, the songs that they wrote, in the mats that they wove, and even in the paintings that they painted. I think that when we're looking at innovative ways for maintaining connections, I saw from the other previous presenters about the importance of maintaining social connections to our health. I think art can really facilitate that in a way that it's not putting pressure on us to, interact necessarily, but it's still for those who are a little bit more introverted, but arts gives us a way to express ourselves. And so I think if we're going to be looking at innovative solutions for advocacy, there's so much more that we can do in terms of investing in the arts and arts infrastructure in particular. And so that's one thing that I've tried to advocate for as much as possible. And so I think that's about it that I wanted to say. I did also want to add that health and climate are really important in the adaptation realm as well. Our country is building a national adaptation plan, and we're looking at the ways in which health is impacted by adaptation efforts too. And so this is and mental health in particular, and that's again where I would bring in the arts to express how are we dealing with these changes. So thank you. I think I'll stop there for now.
Thank you so much, Cassie. It's really good to hear about this experience and about the multiple connections with what we have been hearing already from the other panelists. And I'm sure we'll come back to these points in the discussion. Let's see if now we can go back to our panelist, Professor Ha in Seoul. She should be online now.
Hi. This is Annie.
Very good
I'm
evening.
so sorry. There is some technical problem.
The technical glitch. So
Okay.
We'll show your slides and please take the floor.
Okay, let's move on, children. Okay, this is Eun-hee Ha from UWorld University, Seoul, Korea. I'd like to introduce some children's environmental health issues in Korea and some examples for innovative efforts to translation from science to practice. Next, please. Next, please. Actually, 15 years ago in Korea, there was a little changes regarding environmental policy. There was some kind of paradigm shift toward receptors or health-oriented environmental policy from media-oriented. Next, please. So that time we established NEHAP, stands for National Environmental Health Action Plan. So this NEHAP of Ministry of Environment formulated strategies to eliminate environmental health hazards and reduce their adverse effects on pregnant women and their children. In this NEHAP, we prepared that the Environmental Health Act of Korea. So this the Environmental Health Act of Korea was established in year 2009. And this act addresses that the health of vulnerable populations such as children and pregnant women has to be continuously investigated and evaluated and have to perform risk management of activities space for children and management of hazardous chemicals for children usage. Next, please. So I would like to share two examples of our study, especially from cohort study and in Lao study. Next, please. Briefly, I would like to introduce birth cohort study in Korea. Actually, in 2006, we launched first generation birth cohort study named MOCHE. MOCHE stands for Mothers and Children's Environmental Health. Actually, MOCHE means mother's body in Korean. Through this research, we do have many papers, and we recruited 1,750 pregnant women and follow up more than older than 10 years. And this research showed us that some increasing body concentration of heavy metals or environmental endocrine disrupting chemicals affect adverse birth outcome or growth and development. Some the results are the increased risk of neurodevelopment as well. But it is a little relatively small size of the study. So the Ministry of Environment recognized that we need some national birth cohort study. So 10 years later, we move on the national birth cohort study named KOCHEN. KOCHEN stands for Korean Children's Environmental Health Study. Next, please. This KOCHEN study, we plan to include approximately 70,000 pregnant women by 2020. So this is the ongoing study. Through this activities to the birth cohort study. Next, please. We would like to have the risk communication strategy from research to practice. So this is an examples. Next, please. Some researches are background of the app. Then we could make, next, please. Next. We could make some prediction system of environmental exposures and providing some environmental health information through app or web or online education courses, or sometime because this is regarding children's health, so we could provide mobile game regarding environmental health as well. Next, please. This is one example. Next, please. If we have diet fish information, and at the same time we do have research findings, and then we have some algorithm regarding prediction of blood mercury, meaning that, as you know, if there is some fish amount, we do have the mercury amount in fish, but we do not know the amount of blood mercury of human being. But we have cohort study and results. So if we have diet fish amount, and then we know the blood mercury, and then we could give some guideline to the pregnant woman. Next, please. So this is some example of our web end. If the pregnant woman or you put your information regarding diet habit of fish or demographic factors such as BMI and age, like covariates or confounding factors, then we could see that your level is, where is your level? Yeah. So this kind of activity is one of our co-chance activity. And the other one thing I would like to share is that this is the under COVID-19 situation. So the co-chance team is closely monitoring the COVID-19 situation because the pregnant woman cannot visit the hospital or research site. So in-person component of the following up is not possible. So meanwhile, we have resumed non-face-to-face mail delivery system for data collection, or I2 ensuring that we do not lose touch with our participants. So we could have some online questionnaire system and the delivery system, urine collection container system and kind of things. Next, please. Another example is we have some collaboration study from Laos. This is the project is training girls integrated healthcare specialists and strengthening girls' health empowerment in Laos. We plan to see that what kind of problems of the students regarding environmental health. And then, so before education, we have survey, and then we make some training modules, and then we educate them. And after that, we have the before and after comparison. Next, please. So we have some experimental group and control group and pre and post examination test. After the educational system. So in it, there are some the educational programs regarding how to use the plastics or the chemicals and heavy metals are harmful for your health, or the air pollutions are not good for your health, and those kind of educational contents are in it. So next, please. This is the result. As you can see that before and after, even though it was only a 7 weeks program, but the students are very well trained, and this educational program for the students, especially the adolescent students in Laos, is really successful. They are thinking about that air pollution or chemical exposures are so dangerous for us. So they are very cautious about that plastic use and walking or exercise in outside. So I think this kind of risk perception significantly increased after the program among the girls in the experimental group, whereas the not significant increase was observed among the girls in the control group. So these two, in Korean experience and in Laos experience, we know several things. Next slide, please. Next, please. We do not know exactly what is the chicken and egg, or egg and chicken, but what could be the first. But I think in Korea, we, at the time, 15 years ago, at the time, we have several issues regarding environmental health, especially new house syndrome and new school syndrome. So there are a lot of the allergic diseases. So the Ministry of Environment prepared the NEHAP. And then through NEHAP, we have a lot of finance regarding issues, how to solve this problem. So after the NEHAP, and we do conduct quality research, and then the research output could go into translate into the policy, and the policy into the service, and the delivery of health services could give some benefits of health outcomes for the population. And then so what I'm trying to say is that from research to policy, or from research to practice cycle, is very needed for the susceptible population like children. Next slide, please. So the necessary research effort will not occur spontaneously. It requires a sustained process to update and adapt priorities, and recognition that the strengthening of applied interdisciplinary research to protect health is an essential investment. Thank you.
Thank you very much, Professor Ha. I think that your intervention really adds a very important piece of in this puzzle, and the message is clear, and I couldn't agree more that strong adaptive multidisciplinary research is really a necessity to address the challenges in environment and health and climate change. Certainly when it comes to children, but clearly not much beyond that. I think these messages also apply to the other topics that we have looked into today. So now this concludes the series of interventions from panelists, and we move to the discussion part of the session. There's a couple of questions from the floor. And once again, I encourage participants to enter their questions in the Q&A box, and we will get our panelists to comment and give feedback on those. And we have, of course, a lot of other questions I'd like to raise. There's one booked discussant, someone who we want to invite to join discussion with his reflections on what we heard today. Franz Gatzweiler from Beijing. I think he should be online. So Franz, can you please take the floor and introduce yourself as well? Thank you very much.
Thank you very much, Marco. Can you hear me?
Yes.
So my name is Franz Gatzweiler. I'm the Executive Director of the International Science Council's program on urban health and well-being. And we are based, our office is based in Xiamen, not in Beijing. Xiamen is in the south at the same height about of Taiwan. Thank you for giving me the opportunity to sharing some of the reflections I have with the excellent panelists. The work I'm doing in our program is really that I'm sitting at the interface of an really interdisciplinary scientific committee from health geography, public health, global health, but also systems modelers. And so our scientific committee is very interdisciplinary, and my task is trying to bring together thoughts from very different directions. And I will try to do something similar for this excellent panel. I think there's a lot for us to learn, and there are no lack of innovations. That is the impressions I have from this panel from yesterday as well, but also from the last 6 years I've been working health and well-being, mainly in the city, but also the environment. And I think that we need to start with the recognition that we are dealing with complex systems. Starting point for thinking and acting together is to recognize that we're dealing with complex systems, and that complex systems are really quite a different ball game where all scientists, politicians, citizens, all stakeholders are really on the same playing field, and we're all beginners. And complex systems also confront us with radical uncertainties. That means we need to accept that we, apart from what we can know, cannot predict and cannot know. And COVID-19 crisis has made this clear to us also as scientists more than ever. Nevertheless, in such a situation, we need to make urgent decisions despite values being in dispute and despite the lack of knowledge, and we need to make them together. And another issue is we need to make them faster than before. So how do we do that? I think we can do that by collaborative modeling. And collaborative modeling is a process which very much overlaps to the theme of this panel, actually, of rethinking, researching, and redesigning. And it is a process to combine science, society, the hard and the soft sciences, and especially to move towards accelerated learning by bringing data, knowledge, action together in learning cycles. Modeling is really also not only in collaborative modeling is not only important to understand the complexities, which are difficult sometimes to understand, but also in order to find entry points for action. There are so many brilliant ideas where we can start to improve our environment in order to improve urban or other health, general health and well-being. But there are limited resources for us to do so. So modeling is another way, apart from understanding the complexities, another way to identify entry points of where to start doing what. And what we have heard earlier, the concept of co-benefits is important here, I think. So that is basically the intervention I have. I think our program has thought into that direction of taking a systems approach by collaborative modeling. The collaboration part is important, not only to have people on the same playing field, to give people this in an equal voice, and having different types of data on the table from which we can make decisions, but also in order to improve trust and transparency and to have the values of different stakeholders being taken into account. This is another issue which the COVID crisis has clarified, especially in more developed countries. I'm thinking of Germany, my own home country, where the COVID crisis has revealed deep trust issues between people and the government. So I'll leave it with that. Thank you for giving me the opportunity.
Thank you, Franz. I'm very sorry. Apologies for misplacing you in Beijing. Sorry about that. But thanks a lot for your remarks, which I think are extremely valuable and to the point. This emphasis on complex systems and the need to use system thinking, I think it came up yesterday. It came up in several moments during this session. And I think it's really one of the leitmotifs of innovation. We must move towards that. There's already quite a bit of work in public health on complex systems, but we need much more of that. It's also one of the operational shifts for the future. So we have really a solid basis for doing more of that. We would like to take a few of the remaining minutes. We don't have much time, but I'd like to go back maybe to our panelists in connection to several points that have come up. There's a question, for example, an interesting question on how to initiate or encourage communication across different disciplines. The question is to make aging an urban environment a mindset, but I think it can be extended to all the issues that we mentioned today. So perhaps I could ask you, Cassie, if because it's communication between disciplines, but perhaps the kind of communication, the artistic form of communication that you talked about can really be one where a common, people can engage with, from different disciplines can engage with and can find maybe a common ground for more connection between them. Can you comment on that? Cassie, are you still there? right. I think we don't have Cassie online anymore, or there's some problem in the connection. Let's park this question maybe for a moment. There's several other questions on the table. It's a pity that we cannot address that one, because I think communication is really key in different levels, and hopefully we can go back to that. Another important question, I think, concerns affordability. Affordability of long-term health care as we move, as our societies are increasingly aging. So perhaps, Professor Kondo, would you care comment about that from your point of view in your work you did in Japan, you're doing in Japan? Is the issue of affordability and sustainability one that comes up very strongly, and how to deal with it?
Okay. Japan, the most aged society, confront such a serious problem. Many older people, about 20% older people, need long-term care. So if the standard of long-term care getting better, so the many resources or expenditure is needed. But we have a limitation. So now Japanese society gradually shift from long-term care after becoming disability, but prevent functional decline. A very gradually slow shift, but shift toward prevention is occurred. So recognition of limitation of our resource is essential to begin the shift to prevention. So it is my answer. Okay.
Thank you very much. And that's a related question, I think. And I'd like maybe to ask you, Professor Ha, to comment on, because it's a question in the Q&A box that addresses this perennial issue of prevention as opposed to curative medicine and care. And when it comes, thinking of children, that of course is one of the most evident reasons for investing more in prevention. We also heard from Professor Galea his point on this balance. So I know it's an almost impossible question, but how can we push more emphasis, more investment, more focus on prevention? Perhaps from your work on children, you might have insights that can really help making progress in this respect.
Can I respond first? Okay.
Yeah, please.
This is Annie. Actually, the prevention of environmental health issue or policy or kind of things are a little difficult because, as you know, this is regarding environment and health. So the Minister of Environment and Minister of Health could be cooperate. But as you know, it is really difficult in every countries. But I think the research aspects or translational aspects, it is really needed to prevent children's environmental health or diseases. In Korea, actually, we have several environmental health centers. I think 13 or 14 centers in Korean Peninsula. So these centers are based on hospital and connected with primary health care in the region, local area. So these hospitals and primary health care center get together, and then we make some educational programs and some brochures and contents for let the parents or let the governors and let the children know about how harmful the chemicals or environmental factors to children's health. I think those kind of activities are, we need some kind of initiation or initiative from the government and at the same time from the research scientists and the, the parents or the community people as well. So in Korea, as I told you, 15 years ago, we started this kind of activity through the NEHAP. So every country has to have the NEHAP, National Environment Health Action Plan, for their own. That could be a starting point. And then, stakeholders allow to this, the environmental health issues in practice or in school and in everywhere. That could be one of the, challenges. Okay.
Thank you. Thank you very much. I think this is very clear and very useful. Thank you. We have several other questions. Unfortunately, we lost Cassie Kijiner, so we cannot go back to her on this communication issue, which it's a pity. I think it was really an important one. Let me maybe take one final point out of several that you can see on the Q&A. And by the way, those questions will certainly not be wasted. We will use them in our further thinking and writing up of this material. There's an interesting suggestion that refers to not health in all policy, which is something that we've been talking about for quite some time, and it's also very prominent as a concept for the future in the health beyond health operational shift, which again emphasizes the need of the health sector to go beyond its ordinary remit, but including environmental health in all policy. I think it's a very interesting suggestion. Should we, on the basis of this broad environment that we discussed about today, which is not only the physical environment, but it includes the social, the healthcare environment, should we think of environmental health in all policy? Professor Kondo, what do you think?
We don't have a conclusive idea, but now we are starting point. Some people who have a specialty, for example, health or environment and technology, each specialist gradually aware of the limitation of such narrow specialized research interest. When you focus on some research topic and reveal the determinants factor of something, you must find the collaboration with other specialty is needed to explore the mechanism and build up an effective policy to control those things. So discussion such as today's conference is very needed for very beginning stage of this kind of topic. So congratulations having this kind of conference in Western Pacific region. Thank you.
Thank you. Thank you very much. It's very rewarding for us to hear this comment and most useful. So thanks a lot. There are many other questions on the table and really we would like to continue this conversation, but time's up. And I wish to thank once again all panelists for their invaluable contribution today. By way of wrapping up, I think that I will not attempt drawing trying to summarize it all, because it's been an extremely rich conversation and really lots of ideas for us to reflect about. Perhaps it's easier to look at the work that our designers, illustrators have been doing, because they've been following this conversation and drawing some pictures as some drawings as yesterday. And perhaps we can show them for our connected participants. There we are. And it's really lovely. And I'd like perhaps as final commentary to call on Dr. Gordon Galea. He is in Beijing, and to maybe take us through this picture. Gordon, you're there?
Yes, can we do a sound check? You can hear me?
Yes, we can.
That's very nice. Thank you so much. Again, I echo your thanks to everyone, including our very able moderator, who has taken us through a very interesting sequence of new ideas that fit very well under the theme of innovation. As I've been taking notes, usually under the framework of research, rethink, redesign, I find that we've had a few new R's that have been added. You yourself, Marco, added the importance of relevance, of innovation being relevant and accessible to vulnerable populations and to reduce the level of inequity. And we have seen relevant action being addressed to the issues of the elderly, women and children. We've had a lot of new ideas in terms of some new to the broader public health community. They have had some currency over a few years, but I'll peg them all to Franz's point that we are dealing with complex systems and cannot reduce the pathways to simple linear A leading to B. In Professor Vinay's presentation, we were introduced to the intimate relationship between exposures across the life course, the so-called exposome, the pathway perturbation that help us to understand disease etiology and hazard identification, the importance of feeding our research on environmental health into an understanding of co-benefits. Rethinking was very strong here. And indeed, we were also exposed to another R by Sandro Gallia, the R of reimagining aging as not only a normal process, but a norm in urban environments. He reimagined age-friendly cities along 4 dimensions: physical, social, the shared environment, and the healthcare environment. All of this reimagining, rethinking needs to be underpinned by research, and both our presentations from Korea and from Japan showed the importance of having evidence-based policymaking. Looking at the gerontology survey in Japan over a period of 2010 to 2019, and demonstrating that beyond the normal behavioral and environmental interventions, excuse me, there is a very clear relationship between social exposure and social network and daily functioning in older age, and indeed the risk of dying. And it was quite interesting to hear about receptor-oriented health policy or receptor-centered health policy, maybe another R in Korea with your National Environmental Health Action Plan. With all this rethinking, reimagining, researching, the question
always comes, so what? So we've done all this, and innovation needs to go into some action finally. And Franz suggested that we need to use all this as entry point for where to start action and for doing what. In later presentations, I know we will hear about the concept of aggregation and of portfolio efforts, but this is a teaser for later discussions in other sessions. We've seen these being applied to education, we've seen it being applied to advocacy and activism. We have seen it being applied to environmental regulation and policy. Maybe the last word goes to Cassie. Sadly, she is not with us, who I think moved us all with her poem and the sincerity of her performance. And to her, I give the last R. Not the R for art, because that is a pun and not really an R. But I have to admit that I had a tear in my eye when she was talking about this last R, the radiance of solar villages. So thank you to all for such a moving set of presentations and such a wonderful set of new ideas. Over to you, Marco.
Right, good, and thank you so much for your remarks, the R-based remarks once again, and then we stop the pun. So it's for me now to close this session. Once again, thanking panelists, attendees, as this is the Zoom language, anyone who connected, and our different offices, WHO offices in Manila, Beijing and beyond. So do not miss the rest of the program of the Innovation Forum. There are several more sessions to come as described in the program. And for now, from Seoul, thanks once again, and have a good day all. Bye-bye.